Hello, everybody. Welcome and thank you for joining us for today's ASA webinar, Age Your Way, Planning for the Future. This is part of the Empowering Professionals in the Aging series presented by Home Instead, franchisor of the Home Instead Network. We will be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. Under the tab labeled CE application here, you'll find information on how to obtain CE credit for today's event. You will have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is if you're watching as part of a group and did not use an individualized confirmation URL, you will not be eligible for CEU credit because we have no way of tracking your attendance online. If you'd like to receive CEU credit, please be sure to register using your own email address and using that confirmed URL that you'll receive after you register. If you have questions during today's presentation, you can send those to us at any time using the chat box on the platform. April and I will reserve the last 10 to 15 minutes of today's presentation to answer those questions. So now I'm going to introduce today's presenter. We have April Ibarra. She is a gerontologist and strategic partnership manager for Home Instead with more than 25 years of experience in healthcare and aging. She is passionate about improving the lives of older adults through advocating, educating, and providing resources to help them live with their highest quality, most independent life. April, thank you so much for joining us today.
Thank you so much. I am really excited about today, and everyone who's out there listening, thanks for joining. We appreciate it. What a great way to kick off our year, talking about two of my absolute favorite things, and I know I say this every time, but I mean it. Age your way and planning for the future. And I really like this term, age your way, because I think it's so important for all of us to really think about it. Now, this is, many of you on the call work with aging adults, you have aging parents, you're aging yourself. But basically, what does it mean to age your way? The way that I want to age is going to look totally different from what you want, and vice versa. So we have to remember that with our clients, that it's important to think about what your aging experience will look like and to plan for the future. I can't emphasize this enough. So I really am grateful that you're here. I hope you'll help me spread the word. Let's help everyone understand that it's not by accident that we're aging. Every day we get older, hopefully, and so it's important that we plan. So let's jump in here and talk a little bit about the objectives. Let me get my deck here. So as you can see here, I've got lots of different pictures. I probably need to update these every 6 months because I tend to change my look. But today what we're going to talk about is a few important things. We want to talk about how to plan for the future so that everyone can achieve their own goals. As I said, it's no accident that we're aging, so we really need to look ahead sometimes, think about our own unique circumstances, and decide, how am I going to make this happen? How can I do this my way? And we want to identify how to age in place. That's a big, big buzzword. I think it's interesting to talk about. We'll get into a lot of different aspects of that, but we have to look at potential and existing future needs. So we'll kind of dig into that. We're going to talk a little bit about home hazards. I think it's important to know, if you're talking about aging in place, what you need to look at in your home so that that is a reality. We'll touch on that. And then we want to talk about resources and options, because aging in place is not an option for everyone. So let's talk about research. It's always important to look at the numbers, and it's no surprise that people do want to age in place. Statistically, at least 90% of people say they want to stay in their homes as long as possible, and that they believe that this residence is where they will always live. Now, sometimes as an observer, whether it's our own family or it's your clients, we know sometimes that is not going to be possible. Um, so, how, what is it that's going to be a barrier? What does it really mean to age in place? We use this term so often, and I think we only consider there the home, right? Can mom live here with the stairs? Just go down to do the laundry? Is this feasible? But it is so much more than that. We just came into 2022. We've survived. We are surviving a pandemic, and it's still all over the news. We're more and more isolated every day. And so, even if that home is conducive for someone to stay at home, is it the best option? What would they need to stay there besides the things that we think of automatically, like, well, it needs to be able to get around in a wheelchair or a walker, it needs to be safe, all these things. But what about the isolation? Big concern for so many of us, not only in our own lives, but in the lives of older adults. It's certainly not going to be an issue that's going away anytime soon. So when we think about aging in place and just the desire to do so, we have to look at the bigger picture, the isolation. Nothing changes an older adult's life more than lack of transportation. So that has to be considered. My aunt, my parents are deceased, so often talk about my aunts because they're the ones I'm caregiving for now. And I've seen the changes. 2 years ago, my aunt gave up her car, and she has been declining rapidly ever since. So, and we know that transportation is not easy, right? You can't just, pick up the phone and have somebody come and get you because you want to go, down and get an ice cream or just go pick out your own groceries at the grocery store. So, isolation, transportation, the home itself, access to things that we need, such as food and support. And why do people move from their homes? If everybody has this desire to age in place, what is it that prompts us that we can no longer stay there? We're going to talk a little bit about that. But, the average age of people who do move to senior living communities is about 84. So we know that people wait as long as they can, and sometimes they just can no longer manage at home without some sort of support. So more research also just talks about, okay, so what are people doing about this? And this is where I start to get a little bit excited because we have to get people planning. And that's, again, something you're going to hear me talk about over and over again. So we're looking at this information. Only 36% of those wishing to stay in their current home have even thought about making modifications. So, and nearly half of seniors surveyed have taken no action to ensure that they'll be able to live in their own home. So, A, we know people want to age in place. B, it kind of looks like we're not doing much about it. And I think sometimes we just don't consider that we are even aging. I don't know about you. I get up, I look in the mirror, and I think, I don't know who that person is. I don't sometimes recognize myself. Inside, I feel the same. We've all heard that. But on the outside, I also realize, wow, things are changing. And I'm a gerontologist, so I anticipate this maybe more than some people. But sometimes there's denial. Sometimes there's, because there is no discussion, we just don't even consider that things are going to change. So what are we going to do about it? You know, and we'll talk a little bit more as we go along too about, what do we need to age in place and support. But we have to have that circle of care that can help us, because the biggest issue is it's undeniable that at some point in our life we are going to need some support. And so that we know as we're growing older, we're going to have a plan for, well, what might I need? What might that look like? So I hate to keep talking about the bad news, but again, this failure to plan is the biggest issue. And I know many of you on here have your own aging family members, and this is a massive frustration. But there are some things we can do about it, and we'll get into the good news here shortly. Um, Only half of older adults have planned or even thought about developing a care plan for themselves. I have recently filled out a care plan. We'll go through some of that as we move along, but there's some great tools out there to help guide a conversation and to, kind of lay out the next steps of our life. We plan so many things in our life when you think about it. When we're a child, obviously we kind of just cruise along, but you get into young adulthood, you start thinking about college. Then you start thinking about marriage and then a family and then a career and retirement. But how often do you hear people talking about, I want to plan what it's going to look like for me when I'm older? Well, if you want to age your way, you're going to have to, right? And 73% of adult children have also neither planned nor thought about it. Now, I have some biases. You'll hear as we go along. I am a social gerontologist, so I am a firm believer that the aging adult is the decision maker. They are the ones who are responsible for their life. And there are times when family does need to get more involved, but that's traditionally when there's just cognitive decline, so that person is no longer competent. Other than that, I'm always going to be positioning this is really about getting the older adult to decide what they want in their life. And again, I understand it's frustrating. I have many examples to share, but it's important that we let them guide the way. And we know that they don't want to be a burden. 45% of Americans and 28% of those over 65 have yet to begin discussing. So they don't want to be a burden, but they also don't want to talk about it. That's a problem. We've got to start talking about it. I think these are some good questions. I know it's a little tiny to look at, so let me just walk through some of these. These are things to help you and your clients or your family start to talk about expectations about aging. Just some great prompts. And I'll just going to read a couple of them, and we'll dig in deeper. But at your age and given your gender, how long are you likely to live? Now, I have this discussion quite a bit with our financial planner, and I'm kind of like, I know the range that I'd like to be in. I'm not one of these people who wants to live forever, but let's face it, it's not in our control. But we are living longer. So based on our history and our, if we're male or female, how long do we think we have, and what's it going to look like in the next 10, 15, in some cases 20 years? What do you look forward to about getting older? I'm getting older. I'm going to be 58 this year. I find myself, and again, I think like a gerontologist, but I look at the different age groups and people in their 20s, and I have no desire to go back to 20, but I think, they're in a different place in their life, and rightfully so. But when you do get older, there are so many beautiful things about our age, the freedoms and the comfort in your own skin. You don't have this need to please everyone. But it's good to think about, right? What do you think will be great about getting older? And then as you do get older, how can you best take advantages of the experience and the wisdom that you have accumulated? How do you share that information? I just started taking a writer's workshop this month because I want to start writing. And I think if I can share some of my stories, some of my learning experience, and share those with other people, guess what? They can learn from that, and maybe it will help them as they grow out. Yeah, I'm not necessarily going to go through all these things, but you want to think about your cognitive function. Obviously, that's one of the bigger things. Physical frailty and cognitive function are the two major declines that we have to deal with. But we also have to talk about our legal and financial steps. I hate to tell everybody, but there is a cost associated with aging. I think people are starting to understand that Medicare is not going to pay for our aging experience. Years and years ago, I think people still thought that Medicare was, going to, save the day and pay for whatever they needed as they age. Not true. And with the growing aging population, how is that possible? Right? So we do have to really kind of look at our financial future. And if you're, somebody who is, still of working age, or you're young and starting out, please save. Please invest. It's important. and talking to your family about, what would happen if this happened, and kind of preparing and knowing what support you have available. What would you do if you became sick or frail? And we think about getting frail, but things happen, acutely and then over time. I'll give you an example. Over the holidays, I had an issue and I thought I was having a stroke. Like I said, I'm going to be 58 this year. I was with my husband having coffee, and all of a sudden I was slurring my words. I was having trouble walking. I was having trouble communicating. And this went on for a couple of days. Now, I am familiar with strokes. I used to work in a rehabilitation hospital, so I know the signs and symptoms, but I thought, what is going on? I did go to the hospital, was assessed. They didn't find anything wrong. And then I did identify I had had a medication mismanagement issue. Long story short, I was not having a stroke. But just like that, everything in my life could have changed, right? So we don't know when things will happen. It can be a slow progression or it can be a quick, acute issue. What is going to happen if that happens? And then how will we pay for care if we need it? So lots and lots and lots of things to think about. In general, with natural aging, we know that everybody progresses at a different rate and aging looks different on everyone. I have a 40-year class reunion coming up this summer. Not super excited about it, but I can guarantee you there will be people in that room that I don't even recognize, and they may not recognize me because everyone does age differently. Most of the changes are gradual, but they start to accumulate. I think that's the hardest part because you can have someone who you think is aging pretty well. You know they are probably dealing with some chronic conditions. 80% of older adults do have at least one chronic disease, 60% have two or more. Those chronic diseases are never going to go away, and they do start to make aging a little bit more difficult, but it's kind of gradual, right? You don't notice so much. But then it's interesting how quickly things can change. My aunt is an example. I think when she stopped working, when she gave up her car, six 6 to 9 months later, the decline in her has been dramatic. I actually did a video interview with her. I love talking with aging adults, and it was only about 18 months ago that I did this video. And then when I see her now, I can't believe the difference. So these things do accumulate slowly and gradually, but sometimes based on other things going on. And in her case, I think it's isolation because she's just not engaged. I do start to see those changes come significantly. So these are some things that we can observe and expect. Age is also a risk factor for cognitive impairment. Okay, that's when it really makes it difficult for an older adult to live at home without support. Because when they can no longer function safely at home, that's a lot of the reasons why they would need, to look for more supportive services. The key thing to think about when we're kind of looking about when is a change needed. There's a couple of things because as you're observing your clients or your parents or your family, you can't fight all the battles, right? You don't like the fact that mom won't pull up or throw rugs or that she still goes down to the basement to do her laundry or whatever it is. You can't always fight all the battles, but there's things that you can take a look at to say this is starting to accumulate a bigger concern. And we can put those in a couple different categories: mental, emotional, and social, and physical and medical. Mental is clear, right? When we start to see forgetfulness that impacts daily life. When we see things around the home, it's so easy to observe if you're there. Things like scorched pots and pans, missing doctor's appointments, a messy house, those types of things. Of course, losing track of medications or taking the wrong medications is a serious issue. Hey, that just happened to me. And look what I thought. I thought I was having a stroke. I wasn't, right? A reluctance to leave the house. That's an indicator. Withdrawing. and looking for signs of depression. And let's face it, these days are very challenging. I mean, we're just jumping into 2022, and already with the COVID resurgence, there's so much emotion around this issue that it's getting more difficult for everyone. And imagine if you're an older adult who lives alone, who has all these other things going on. It's just a big struggle. If they start losing interest in meals, their personal hygiene. I mean, you can just kind of take a look and say, gosh, dad was always well groomed, but now I can smell his hair when I walk into the house because he's not been showering. These are some of the things that you can kind of keep an eye on to say, there might be a need here. And how do we know when it's no longer safe or, or appropriate to age in place, right? When it might be time to consider. And I have to say, when it might be time to consider moving to a facility, but can they afford it? We know that, these options, when we're looking at not only care support in the home, but care in a, like a senior living community, whether it be IL, AL, or, memory care, is very, very expensive. So that's part of the planning too. We know that mom has no money, so how are we going to do this, right? Um, but we know that it's time to sort of start thinking about a change when there's a refusal to accept professional help at home. They're just not willing. The care needs are way beyond what can even be possibly delivered in the home. And the Alzheimer's dementia is becoming a very risky thing when cost for 24-hour care is outside of financial ability. So, if you did have a caregiver coming in, but now you really need 24 hours of care, that's different. And when family is not available, there's about, oh gosh, I think it's about 29% of older adults in the United States have no spouse and no children and no support. Now, there's a couple terms for that. One that I hate is elder orphans. The other is solo agers. But, when you think about planning and looking to the future and what this aging experience will look like, if you have no support, your experience and your planning is going to look a lot different than I have, 4 children who live in the area. They're all willing to help me and come over anytime I need it, which we know isn't true, right? My aunt, who I'm caregiving for, she's about 45 minutes to an hour from me. She has a son who lives 5 minutes away, but he's a son, and he doesn't quite look at the things that she needs in the way that I do. So, what's available to provide support is very important. All right, we have to talk about the cost of care. I pulled up a bunch of different articles as I was preparing for this, and we know that inflation. You probably saw some news going around that I think inflation hit an all-time high recently, and it's no different in the aging industry. So the cost of care is skyrocketing. And the reality is that 70% of Americans who are older will not be able to care for themselves without assistance. So when I said there is a cost associated with aging, there simply is, right? We cannot say, well, I hope I don't need anything because, I really can't afford it. Now, some people, especially when we're talking about today's aging population, if they have not invested, if they have not saved, if they did not have these, these luxuries of preparing, then it is what it is, right? So my aunt is in the same boat. She has a very fixed income. We're trying to get her into an independent living apartment, which is very high. But her and her son and myself and her are looking at sharing the cost. How can we make this work? Because the reality is it's going to cost something. There was an interesting article that I pulled up on the drivers of the cost of care by Genworth that really talked about, okay, why are costs going up so high? Well, we know that there is an issue with staffing. It doesn't matter if you're at Target or Walmart or you're trying to get somebody to come into your in your home to care for you. We have a shortage of people to do the work. which is causing costs to rise. Demand and strained supply. You've been into your grocery store lately, shops are not full or shelves are not fully stocked. How is this going to impact our aging industry? We know that COVID, is still with us and it is costing a lot of money. We can see costs going up like that. And, cleanliness and safety in every organization, the costs are going to be wildly raging. So, we don't need to beat this to death because there's lots of information that you can read on that. But quite frankly, whatever it is that the older adult needs to support their aging experience is going to be higher. If that's somebody to come into the home and do some meal prep, if it's meal delivery, if it's home health aid, assisted living, nursing home care, the costs are going up. No way around it. And it is alarming. I'm sure most of you are familiar with Genworth and the cost of care trends. It looks, what was I don't have that right in front of me, but the cost, well, I don't need to beat it to death. We know that the costs are going up. It's really scary. So as you are starting to help somebody with their plan, we need to be realistic about how much is this going to cost me if I need to move, if I need help in the home. We have to start the conversation, period. It could be as simple as, have you thought about, what you want as you get older? I know Dad's retiring this year. What is that going to look like for you and Mom? So just starting the conversation, and again, if we are talking to our aging clients or family members, it's their plan, not our plan, right? So I think this tool, which is available to you, and I think it's in the notes in the presentation, is a great resource. There's a lot of good tools out there. If you just Google aging plan or action plan for successful aging, it'll provide you with a framework to start the conversation. And I think that's just where you start. And you can't start that conversation when it's a crisis. And this is something, that I've had a conversation with my aunt because she's in a home. Literally, she lives above a store. She's got a great apartment. She pays $455 a month. So it's in her budget, barely. But she has stairs that are so steep and so dangerous that it really is now becoming a great issue. So, my conversation to her is, what happens when you can no longer get up and down these stairs? And 6 months ago, a year ago, she was in denial. Now, because I planted the seed that long ago, she's willing to have this conversation, and I do have her on a waiting list for an apartment. But it takes a while, so we got to start early. Why aren't we talking about this? Why aren't the older adults planning and talking about it? Why aren't families talking about it? It's difficult. It's uncomfortable. And we would prefer many times to wait until there is a crisis. Now, I don't want to say we prefer, but we just do, right? Dad just had a stroke. He can't go home because Mom's not going to be able to care for him. Okay. Well, we knew he already had health issues. This was a potential. We never talked about it. Now we're in crisis mode. The plan's going to look a whole lot differently, and it's not always going to go their way. And that's the one thing that I use because I think I'm really good, quite frankly, at talking with older adults because I'm always very, very direct and just very open. And I just said that same thing to my aunt. I said, so you do realize if something happens and you can no longer go home because you've had a fall or you've had this or you've had that, it's no longer going to be in your realm to decide. Your son is going to be deciding for you, and it probably is not going to be what you want. Is that okay with you? Now, I have to accept whatever that answer is, right? I cannot force, you cannot force, we cannot make people do things they want to do. My husband won't quit smoking cigars. Well, he's got 6 months to live. He's on hospice. Does it matter if he smokes those cigars, right? Choose your battles. So it's difficult, but it's important to really think about it. So what should be in an aging plan? As I said, an aging plan is not so much about the home and where you're going to live and all that kind of stuff. It's so much more about how do you want to age? What is your health now and in the future? I have a friend who has lost 4 family members to dementia. She has a high risk for having that. Her situation and her planning is going to look much different than mine. We have to look at, again, the legal and the financial matters. How much money is there? Is there any money? What are your social and personal relationships? One of my best friends is turning 70. She has a daughter who lives cross country and she has no other support. She knows that she has to plan that she will not have family to support her. So she's building her network now, which I think is so important. It's not impossible, but it is important to kind of think about it. Okay, so I'm taking my friends to the doctor now and I'm helping them when they need help. Um, Boy, are they going to help me? Can I have that conversation with them? And so I think it's all very doable, but we have to be realistic about what to expect. I am a huge fan of talking about end of life. I think it is so important. I've been reading lots of things, and it's not going to come to me now, but there was an author that I actually it was an ASA podcast that I heard, and it was a particular author who wrote about her parents' end of life and how the last 2 years of their life were just spent in and out of healthcare systems, just because healthcare systems are there to help you live, right? Oh, okay, you've got heart disease. Well, let's get you this, this, and this. Oh, you've got this. Well, let's do this, this, and this. But nobody's looking holistically at your life. My uncle now, I think, is really in end of life, but they haven't told him. So as I'm speaking with my aunt about this, she realizes that quite frankly, he is at the end of his life. So when she has 4 or 5 doctor's appointments for him in a week, I am encouraging her to kind of say which of these are important for his health and for his future. And how can I best support him? He's the one who smokes the cigars. Let him smoke his cigars. Why would you take that away from him now? That's my opinion, but that's how I look at it. Legacy is also important. How do people want to leave their legacy as they die? I love storytelling. I love older adults telling their stories. That's why I'm taking a writer's workshop. I really want to help older adults tell their stories because they have some phenomenal life stories to share. As we're looking at what's available to help, we have to look at the family. We've kind of talked about this. Family's difficult. There's no way around it. We have fewer family caregivers, and traditionally, even if there are multiple children, there's one who really is the predominant one. The rest of them kind of argue about it. So we have to know who really, realistically, just because you have, 4 children doesn't mean they're available to help you care. How much time do they have? Are they close enough? What would happen if my daughter is willing, but she can't afford to not work? How do we kind of take a look at that? And, I think one of the bigger things to consider is will they feel comfortable providing all types of care? I've already informed my husband will never, ever, ever take me to the bathroom if I can no longer do that on my own. That's just my personal preference. I don't think I want my husband, even if he is more than willing, to help me toilet. So now my aunt, on the other hand, whose husband is nearing death, who smokes the cigars, she doesn't mind at all. And he is quite incontinent on all levels. So you just have to know who is available to help and what would you feel comfortable with them doing. Family's not always the best to do those things. When you're involving family, there's just, again, this is not a presentation just about that. We could spend a lot of time, but there's a couple things you can do. Obviously, involving your aging loved one if you're concerned about your aging mother or your parents. This is not your plan. It is the aging loved ones. So you need to know what they are, what they need, and that's where the plan comes into place. And you have to prioritize those needs. Choose and pick your battles. Some things just aren't important. Maybe they're important to you, but they're not to the older adult. So be mindful of that. I think that's really, really important. Know what options are available. Understanding what pays for what. For example, Medicare will cover for short-term rehab, but they don't pay for long-term care. So understanding realistically what the costs are. This information is easily available. Divide the workload. Okay, the the brother's good at budgeting. This daughter over here is a good listener, a good supporter, and I'm more tactical. And I can get in and just clean the house and prepare meals. So, divide the workload up, plan ahead as much as possible. That will make it all easier. And know that there are family dynamics. I would love to hear some of your stories. It really, it's incredible to me actually that sometimes it just brings out the best and the worst in people, but it does. And there are a lot of hot button issues, including illness, denial. No, dad doesn't have dementia. He's fine. It's not really an issue. The daughter who's doing the primary caregiving knows better. Finances. How many of you know what your family's finances are? Again, why don't we talk about it? It gets a little uncomfortable, but that shouldn't stop us. We have to be able to at least provide some tools for these people so that they can plan and address the financial capabilities to provide what they may need in their aging plan. Inheritance, we know that this does create many issues. Maybe there's enough money for a senior living community, but one family member doesn't want to spend the money because they want more left for them. Not nice to say, but it does happen. And then other people are more than supportive. So these are just some of the family dynamics, along with long distance. Most people do not live close by anymore. It has changed. And the stress of this, along with everything else going on in people's lives, really make it very challenging for families. We've already talked about aging in place, so this is kind of a little past. But again, what is it? It's the ability to live in one's own home and community safely, independently, and comfortable, regardless of age, income, or ability. Boy, that sounds great, doesn't it? But quite frankly, we know that our low income folks, people who can't afford to pay for things out of pocket, may end up in nursing homes because that sometimes is the only solution when there isn't money to pay for things in care and money runs out. And I'm not an expert in all of that, but obviously, there's only so many resources to pay for things. And as we already know, it's quite expensive. Medicare Advantage plans are offering a little bit more, but they're never going to be a long-term care solution. Medicaid is the primary payer these days, depending on what your state benefits are. And then sometimes there are waiver programs in various states that will really provide supportive living situations because it's a whole lot cheaper to care for somebody in their home than it is in a facility. VA benefits. My uncle is receiving VA benefits, and my aunt, who is the caregiver, is now getting paid for that. She just found this program and applied for it, and I just think that's fantastic, and she was thrilled. Obviously, there's long-term care insurance. I'm not so sure how I feel about it. I'm at the age right now where I need to think about, am I going to buy a long-term care insurance policy? So I'd love to hear from you if you have some thoughts on that. But I do believe insurance is possibly a good idea because we know that there is a cost with aging. Private savings, okay, yep. Well, if we're fortunate enough to have saved and planned, my aunt has a very minimal amount of money left, but she's concerned about spending it. And I said, you know what? You save that money. So spend it for you. There's no need to save it for anybody else. And you just have to decide, A, is aging in place right for you? And B, if it is, what am I going to need? How am I going to pay for it? There is a lot of support if you want to stay in their home, in your own home. There is, and you can see them here. There is transportation, although that one, I shouldn't have started with that because I think that's still limited because quite frankly, I can get an Uber to downtown if I want to have dinner and I don't want to drive, but my aunt is probably not going to be able to get on an app, order an Uber, pay for it to go to her doctor's appointment. Although Lyft and Uber do now have Uber Health and Lyft Health, and those are kind of interesting programs. But we're way, way, way behind. But let's face it, as we look at this list, it's a great list, and there's lots of things that we can get. But if you don't have the money, it kind of limits your resources. It truly does. Shifting into a little bit more, and I'm not going to spend too much time on this, but I think it's important to talk a little bit about the home safety. It's a big topic. For years, I did many, 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 many presentations on fall prevention. I worked for Phyllis Lifeline for years. I do know that the fall is the number one thing that starts to change people's ability to live at home, and then they become afraid of falling, and oftentimes it is what ends up really creating some big, big problems. But so let's just kind of take a look a little bit about making the home safer. I'm going to talk a little bit room by room, and I don't think it's rocket science here. You don't have to be an expert to really look around someone's home to identify some risks. I am a certified aging in place specialist, but anyone could kind of take a look around and say, that walker over that rug with that cat over there is a problem. And, I talk about my aunt a lot. I'm going to see her tomorrow. She knows I mention her in all my presentations. She did a little cat sitting for her granddaughter over Christmas, and she told me, well, I fell over the cat. I said, well, yeah, duh. Of course you fell over the cat. The cat is in between your legs. You're on a walker. You got a lot of stuff in your home. And I just tell her that. She said, I know. But, can't, dance around the obvious issues. Room by room, we can kind of take a look here at some of the different hazards. And this will be available. I just saw that. Okay, hopefully you can hear me. I just saw a little note that I'm in the same place. I hope everybody can hear me okay. Hope there was no issue there. This resource is available to you in the deck. I believe there's a link. If not, my information will be there. Reach out. It's a great tool. There are many things out there on home safety. But, when we look into the living room, we're kind of look about lighting. That's a big issue. Many people don't have good lighting in their room, or I love it when, let me get that light. They have to go all the way across the room to turn on a lamp, and therefore that makes it a really, really risky area. Clutter. We accumulate things, and aging adults today do tend to like their stuff, but it's a false risk. And, that could be everything from just magazines on the floor, rugs, electrical cords, those types of things. But we can just take a look around and just make some quick assessments and make some quick suggestions. And my big thing when I was doing fall prevention years ago, I always like, well, what are your goals? And it would always be, nobody ever said, I want to move into a nursing home. Nobody ever said that. So I would say, okay, if your goal is to stay in this home, what are you going to do to make it happen? And then when you put it in their hands, their decisions, they are far more likely to think, all right, well, here's what I can do. Here's what I'm willing to do. Great, let's do it. Kitchen is a big room for hazards. And, this can be everything from, spoiled food, if there is a bit of cognitive decline, to leaving things on the stove. I think about some of the pots and pans that I use. I like my cast iron, but I have a big old pot that when I have to lift it up from the bottom, it's very heavy. So just working in the kitchen to say, how can mom flow in this kitchen safely? Does she have a place to sit? Or is everything she needs at counter's reach? Is the lighting good? What about, just how does she function here? So she could sit down easily in between, and God knows not everybody cooks anymore. And that's also an issue. So if we can just get them comfortable in the kitchen, make it very easy to navigate, it's going to be a little bit safer for them. We know that many things happen as a bathroom. I mean, who doesn't get up in the middle of the night and go to the bathroom? If there isn't correct lighting, it can be a big issue. According to a survey of ER doctors, 69% of home injuries do occur in this room. No surprise. When I worked at Lifeline, the stories that I heard were incredible. I had a woman who she took her bath every evening. Hey, I take a bath every evening. Why would that change when I am 78 years old? But she took her bath and she didn't fall. She didn't have an issue with that. She could not get out. and she sat in the bathtub for 2 days. So just don't look at the obvious things, but think about their patterns and how they spend their times and how we can help. Shower modifications, such as the shower chair. Of course, we have to be concerned about it being slippery, but what about just being able to stand long enough to be clean? So there's lots of tools out there. I'm not going to spend a ton of time on some of this, but I think we all are aware of some of the things that we can do to make some improvements. And we start by just having the conversation. I think in the bedroom too, it's like, what is the height of the bed? When they get out of it, what does it look like? Is there a chair around so as they're getting dressed, they can sit down, put their shoes on? How about the lighting again? Is there a lot of clutter? Is there a cell phone? Is there a phone nearby? I still am a fan of medical alerts. I know that people don't want them. There is a ton of good technology out there that's very interesting. But at the end of the day, you have to ask your clients or your aging parents, if something were to happen and you could not get up, how would you get help? Right? Just like a fire alarm, how am I going to get assistance? Why are older adults so reluctant? Well, first of all, they're fiercely independent, and I know I am. It's not going to change just because I'm getting older. So many times they hold on to whatever control they have. So if I come in as the daughter, a very forceful, Mom, I'm worried about you. Let's get those rugs up. Let's do this. Let's do that. Chances of her being willing are very slim, right? So we have to put those decisions in their hands. We have to plant the seeds, and we have to start talking about this stuff very early. Nobody wants to look like they're an older adult. So, some of these home modifications, they don't want to see a big, a toilet, raised seat, those types of things. But again, if you go back and you ask them what their goals are and how they want to live their life and what they want, then I always go back to saying, then what are you willing to do to make that goal happen? Is a raised toilet seat too bad? No, I guess I could live with that. Okay, great. They don't want to ask for help. Why would they? Nobody wants to ask for help. This does not change just because somebody is older. And many times there's these emotional connections to these items in their home that is just, you just have to remember that. And again, pick and choose your battles, right? Cognitive impairment is obviously a big concern. If somebody is cognitively impaired, we cannot always talk about rationally just saying, well, Mom, that's ridiculous. You have to do this. Well, understand what you're dealing with, right? And then many people just refuse to ask for help. And so it's fear and it's refusal. But again, I think it's all in our approach. We know that there's a lot of senior care options. There's a whole list here. It really sounds like there's so many resources available, but in reality, I don't know how you feel about it. I think for the average person, it's just very limited. But you can see the list here, ranging from skilled nursing, which is traditionally short-term. Your traditional nursing home is where you're going to be needing round-the-clock care. You can't physically care for yourself. You need a nurse to be involved. I think memory care support is probably more, that's such a true need. When somebody can no longer care at home and they have to be somebody safe, that's a trigger for, I'm going to have to look for some options. Other ones, of course, include home health care, which is more of a skilled care. Having somebody come in, it's those basic activities of daily living that they need help with. And somebody to listen, somebody to just help them get the groceries up. Little things can really make a big difference. When we're building the plan, we have to kind of look at the current needs, which I think is important. Right now, Mom and Dad are doing okay, but what is it going to look like in the next few years, right? Well, Dad just got a diagnosis of Parkinson's disease, so currently he does fine, but we know in the future we're going to need more, right? Eventually, we're all probably going to need a little bit more. And then what support can we provide? What is the family available? What friends are around? Is the spouse still there? Budgets. and then again, the communicating the plan. And again, many times it's a chronic accumulation of things over time, and sometimes it is that immediate issue that happens, such as a fall or a new diagnosis, or obviously the loss of a spouse really makes a big difference. I love this quote because I am a firm believer in there's so many positive things about aging, but many times we often just focus on the bad because at the end of the day, it is difficult. There's a lot of really tough things that we end up having to deal with. Um, but if we have that plan, if we have the conversation, if we set our own expectations and try to make the best out of how we feel we want to age and what we think may happen based on our own health history and our lives, it doesn't have to be negative. As a matter of fact, I think it's quite beautiful. So I have really gone through a lot in a very quick period of time. I see a lot of questions coming in, so I'm going to take a little pause. And we've got some time. And I will just encourage all of you to reach out to me. My email is in there. I love to collaborate. I love to discuss. My email is available. You can also find me on LinkedIn. But I'm going to stop and see what kind of questions we have.
Thank you, April. I really appreciate the layout of your presentation that you had. You really did a great job of kind of taking us from beginning to end and really stressing why planning is so important and how that can allow us, anyone, to age the way they choose to, and how we all hope to age and stay at home. So one of the questions that came in was, can you just touch on the difference between an assisted living facility and a skilled nursing facility?
Sure. So in general, an assisted living is going to be where somebody has an apartment of their own. Traditionally, I think they're usually private, right? So you're going to be in a supportive place where you can get services. And so that could be everything from, and traditionally, one of the needs is medication management, right? Mom's not taking her medications. As a result, everything is getting out of control. Mom's not cooking. Therefore, her health is declining. So the meals are great. They may, of course, provide housekeeping, those types of things. So it can be, every community is a little bit different. It can be a little bit of services. It can be a lot, and sometimes it's a la carte. So it can get very expensive, but it is nice that it can be customized. And then I think the other portion was, what is a skilled nursing facility? When you think about a skilled nursing facility, a couple different ways you can look at that. A skilled nursing facility is traditionally probably like a short-term rehab. So, for example, my aunt had surgery. She could not go home without, because her home was not safe. She was eligible based on Medicare to go for rehabilitation, to get herself strong, do some therapy, then go home. So that's kind of the difference. And then, our concepts of like a traditional nursing home, when you think about years ago when people went to nursing homes, that was really, kind of 24-hour care when somebody is not able to take care of themselves at home. And traditionally, I think one of the reasons people need that is because Medicaid is the only thing that pays for that. And for people who are low income, who don't have the money, that may be the only alternative.
Right. And I think it's very important that we stress that some of the options that we talked about today are not available to everyone, and not everyone would want that. It's based on where you live, based on other factors, the regulations in your state, and even just a person's individualized life course, how they got to where they are now. It's so different for everybody. So that's why it's so important that when we take planning for the future, when we start having these conversations with folks, that we really let them maintain control of, because they're their own experts in their lives, and they're the ones that really know what they need. So I think that's important.
It's hard to do, but it's going to get us further in the discussion. And I have a way of being very frank with older adults that, I think they appreciate, because I don't coddle them. It's like, well, that's your decision, but I just wanted you to know what the consequences might be if you did this versus this.
Right. Absolutely. I think there's a very big difference between being honest and open about possibilities.
Mhm.
Should X happen, then Y or Z could be the results. I think
Yep.
that's a great approach. I agree with you completely that we need to maintain their level of dignity and remind, sometimes as caregivers or as a professional or personal, and as family members, as daughters and sons, it can be frustrating to watch your loved one make hard choices that you may not agree with, but we always have to respect their wishes as long as they're, like you said, capable to do so.
Yes.
Another question
Amen.
that came in is, when do you recommend really a time to start the aging planning process? What would you say?
Oh, that's good. That's good. Gosh, I think earlier the better. So, for example, I mean, I'm 58 now. I don't have children, so I don't have anything to plan. But me and my husband talk about all of this all the time. But so, for example, my aunt, though, I knew she is 77 now. So 2 years ago, I knew that, okay, well, she has one son, she has limited income, she's by herself. I started, I gave her a plan. I said, would you mind filling this out? I would love to just learn from you what you want. So I would say before there's major health declines, but when somebody is obviously getting older, obviously somebody in their 65, just retired, probably, doesn't want to think about it. You hope that they still have basic things in place, right? Like their financial plan, perhaps their wills, their powers of attorney, that kind of stuff. And then progressing into more of a, well, what would you want something to look like if dad died? Or what is your end of life goals? Those types of things. And it could be a discussion that builds over time. Or if you see somebody is willing to it, say, hey, here's a great resource. Take this, spend some time with it, and share anything in there with me if you'd like to talk about
Absolutely. I always think of the same thing too. Is I don't think there's ever a time that's too early to start
it.
having those conversations. I'm still younger with young children at home, but I have those conversations with my
Mhm.
husband on a regular basis too. And maybe that's just because we're both gerontologists, and
Could
that's what we
be.
think
We
about
we
all day.
live and breathe.
Right. Yeah. And he's always like, what? He doesn't even know what I'm talking about. He's
Yeah,
like,
right,
why
right.
are we talking?
I feel you.
So, but I'm under the impression that there's always, now no time like the present to think and let your wishes be
Mhm.
known about how you hope to be cared for and what your wishes are
Mhm.
after you um, take your time here. So
Mhm.
another question is, someone had asked if you could explain a little bit more about long-term care insurance and the different policies.
Mhm.
And I know you mentioned that as a possibility of a
Yeah.
payment source for different types. I would just stress to anybody that's looking at to a long-term care policy to really utilize their state's SHIP resource. Every
Yes.
state has
Yes.
a SHIP program with experts on these life and long-term care policies, and they're trained on how to read these policies. And so going to your state SHIP office or the Seniors Health Insurance Program would probably be a really great resource for that. I don't want to get into too many details because the plans vary so
It's
vastly,
complicated. They
and
do.
it is
They've
very
gotten a bad
complicated.
rap. Yeah, I think over the few years, maybe they didn't have a very good. There was not a good impression of some of these because older policies weren't so great. The industry is changing a lot. There's a lot more options. So do your homework, speak with experts, and best understand. So I think that's
Yeah,
good advice.
absolutely.
Yeah.
Thank you. And yeah, I'm glad, again, it's so hard when we have these giant, big webinars with people joining us from all over because a lot of this information, it really is based upon where you are, what's available in your area.
Yeah.
So I think that's important to stress. We do have
Well,
time
yeah,
for
like
one last.
yeah, for example, like question
Yep.
number 8 that talks about waivers. Waivers are traditionally state dependent or state influenced. So, because they're usually funded by Medicaid. So, yeah, that's another one where go to your area agency on aging to learn more.
Yes, absolutely. And we do have one last question. It's kind of, how do you recommend working with an older adult that may have some hoarding
Hmm.
tendencies
Yes,
and an emotional
I see
attachment
that.
to the things in their home?
Yeah, there's a difference between a hoarder, I think, and emotional attachment. I am not an expert on hoarding, but I think it is a more of a psychological issue. So know that it's not just a simple attachment issue. It is oftentimes a psychological issue. So I think you just have to appreciate or really kind of understand that individual person. But when it becomes an issue to where safety is really a problem, because many times they couldn't get out if there was a fire or if the ambulance needed to come. So if it is that type of situation, then you need to seek maybe, gosh, I'm drawing a blank on, calling it for protective services, adult protective services, or seek, helping that older adult to seek psychiatric treatment. Tough one.
Yeah, that is tough, but you're absolutely right. There is a major difference between the psychological diagnosis and a lot of times just an abundance of clutter, or
Hmm.
possessions that are important to someone. So I'm gonna, if April, if it's okay, I've pulled your email up on the screen. Is it okay if people contact you via
Yes,
email? Okay,
please. Absolutely.
fantastic. Because I know there's questions that we did not get to, and we apologize for that, but we want to be respectful of everybody's time. And it's 2 o'clock Eastern time, so we have met our deadline for today. We want to thank you all so much for joining us again. April, thank you for joining us, and Home Instead, you guys are such great partners for American Society on Aging. We really appreciate it. Again, if you would like CEUs for today's webinar, you will be getting an email with a link to apply for those. You have 60 days after today to apply, and then again, it may take up to 30 days for us to issue those. Thank you all so much for joining us, and we hope to see you at our next webinar soon. Take care.
Have a great day, everyone.